The Life Esidimeni Inquest resumes this morning. Cross-examination of the former Life Esidimeni Managing Director, Dr Morgan Mkhatshwa, continues. Yesterday, the treatment of patients at Life Esidimeni came under the spotlight. For more, SABC News senior reporter Chriselda Lewis comes to us live now. Very good morning to you, Chriselda. What can we expect today?
As you correctly point out, the treatment of mental health care patients at Life Esidimeni came under the spotlight. The virtual court sitting basically heard that when the Mental Health Directorate had made several surprise visits to Esidimeni, officials had basically found some of the patients were undernourished. So that's what lawyers representing the former Mental Health Director, Makgabo Manamela, told the court yesterday that during those SNAP visits, officials picked up that there were also other challenges at that facility. They said that at quarterly meetings, amongst the concerns raised was that patients at Life Esidimeni facilities were in a bad state. Let's take a listen.
It was discussed during the quarterly meetings that amongst the concerns which were raised by the MHD was that patients at Life Esidimeni facilities, other facilities, were in a bad state. They were sickly, they were frail and malnourished.
Absolutely untrue.
Doctor,
yes.
It is my instructions that on numerous occasions, the MHD raised the issue of patients with lack of clothing. Those were raised during the quarterly meetings.
All our mental health care users had clothing.
Issue that came up, Chriselda, was that this...
Well, Desiree, despite Dr... Yes. Please go ahead, Desiree.
Another issue that came up was that this process of moving patients was valid but was supposed to take 7 years. What did we find out about why it was rushed?
Well, Desiree, a lot of questions were asked to Dr. Mkhatshwa about the process itself. He says at several meetings he had raised concerns about the process itself and how the process itself was being conducted, that meaning the transferring of the patients. And I recall hearing distinctly in those in that court sitting where several meetings were mentioned about how tempers had fled and how basically Dr. Mkhatshwa had even asked whether there were clinicians why this process was being handled in the manner in which it was being handled. He claims that he had expressed concern about the nature of how these proceedings or how the transfers themselves were being conducted. But a bit earlier on, when you heard that clip, they were pressing Dr. Mkhatshwa on the issue of the transfer itself, the state of the patients at Life Esidimeni. And despite Dr. Mkhatshwa's denial, lawyers for Dr. Manamela basically pressed on. Let's take a listen.
Instructions by Dr. Manamela that from the report she received from her team, the multidisciplinary task team, patients who were discharged from Life Esidimeni, they were really in bad condition. This was confirmed by Dr. Mabena in a statement. I'll refer you to paragraph 4 of her statement. It reads as follows. The first batch of patients we received were not in good condition and had to be screened from scratch. It would appear that they were not being well cared for. Can you comment there?
I cannot comment to your question in that one, I don't know what time they left the Esidimeni facility, what time they reached Vescopis.
Desiree, you recall that's quite important because in 2017, the health ombudsman, Malachapuru Makgoba, had found that the patients had died from hunger and dehydration after they were transferred to the NGOs without invalid or with invalid licenses. But Dr. Manamela's lawyers suggest that they were in that condition when they left Life Esidimeni. So we're expecting the cross-examination of Dr. Mkhatshwa to continue this morning. This is expected to be his last day. We're expecting a new witness to take the stand tomorrow.
Chriselda, thank you so much for setting the scene for us. Of course, as always, we'll continue to watch developments.